Welcome to Fundraising Leaders with Drew, where we embark on a journey to decode the strategies that lead to fundraising success. I'm your host, Drew Clancy, and I'm joined today by Dzenan Berberovic. Dzenan is the Chief Philanthropy Officer at Avera Health. Under his leadership, the Avera Foundation has experienced remarkable fundraising success. Dzenan is known for his transforming approaches to fundraising and has successfully guided several major campaigns, including a $30 million project for Avera's behavioral health hospital. Let's jump right in with Dzenan. Well, Dzenan, thank you again for joining me today here. I was so inspired by your story. And as a child emigrating to the United States. And I thought I might just, can you tell us a little bit about your journey from being a refugee to now becoming the chief philanthropy officer? You know, how has your personal experience shaped your approach to philanthropy?
Sure. Well, greetings, Drew, and what a treat to be with you today. So, philanthropy for me is very personal and I think it tends to be that case for many individuals. Either they've had experiences during their life at whichever point that inspired them either to pursue philanthropy as a profession or to give back to causes that meant a lot to them and that helped to either shape their life or enrich their life in some way. And so I say that it's personal for me because I can recount three instances in my life when philanthropy made all the difference. So as a little boy, my mom and I fled the war in Bosnia, which is where I was born. At the age of 3, my mom and I fled the war. She was widowed at that time. Unfortunately, my dad passed away in the war. And so at the dawn of her life, she was widowed and she had me to care for. And so our journey brought us to Germany, where we lived for about 6 years. Many of those years were spent in a refugee camp that was run by an order of nuns. And so when I say that philanthropy is personal to me, it is in every possible way, because today I serve and lead philanthropy at an organization that is co-sponsored and founded by 2 orders of vowed religious women. The Presentation Sisters and the Benedictine Sisters have sponsored our ministry for decades. In fact, Avera's roots date back more than 126 years, when the sisters were called to provide care for their community members and those who needed help. And then as a young boy, when we had the opportunity to move to the United States, that was made possible because of somebody's generosity. And then when I had the honor of going to college and pursuing a 4-year degree, I received a full tuition scholarship to attend the University of South Dakota, and that made all the difference in the world. And so for 4 years, I was the grateful recipient of a stranger's generosity, and every opportunity that I had at the university, every opportunity that I had to engage with constituents or others who were engaging with the foundation or with the opportunity to advance the university, that was incredibly gratifying to me. And so while at the age of 16 and 17, I maybe knew I wanted to work in the nonprofit sector, it wasn't until I was a college student that I knew that fundraising or philanthropy would be an opportunity that you can serve this sector. And so that's what I pursued. And I remember being a sophomore in college and telling somebody that someday I wanted to be a major gift officer.
Wow. Talk about paying it forward. Really, really inspiring. Let's talk a little bit about your role at Avera Health and how you see your position, your responsibilities, how you think about philanthropy, and then how you really translate that into strategies to raise money.
Healthcare tends to be very complex. There's a lot of systems in place that cause healthcare to be complex for many individuals who seek care. But we know every single day that healthcare institutions and hospitals around the country and really around the world are the one organization that serve everybody.
Sure.
Um, if you think about it, there are shelters that serve unhoused individuals. They're serving a very specific population. There are education institutions that serve their students and their alumni and other constituents. Well, in hospitals, we have the great opportunity to serve everybody.
Sure.
And that's not lost on me on any given day. And it's also not lost on me that our work in healthcare does two things every single day. Either someone's life is changed forever or somebody's life is saved. And so there's always this emotional weight that comes with serving in healthcare that oftentimes leads to incredible gratitude that's felt by those receiving care or those who are witness to the care that a loved one is receiving.
Sure.
And I say that because hospitals, I think, in every possible way, are set up to have cultures of gratitude, which lead to cultures of philanthropy or cultures for philanthropy in many ways. So by the time that we at Avera in the foundation ever interface with a constituent, they've already been grateful for the care that they've received in a room or in another patient setting. And so that makes all the difference, where we really end up being Avera's triage center for gratitude within the foundation.
Sure. How do you see, as a chief philanthropy officer, you're responsible for transformational giving, obviously leading your team, board engagement, campaign planning, donor stewardship. How do you balance, or how do you see these different roles and responsibilities, and perhaps do you have a philosophy around how they all potentially work together?
Yeah, sure. Well, to help set the stage, in the foundation, we really have one North Star, and that's to provide every single constituent a gratifying giving experience. So
Love
it
that.
does not matter if you are a member of the Avera family, an employee at our organization who chooses to give a one-time gift of $5, or if you are a grateful patient or a grateful family member who chooses to provide $100,000 back to our organization. We want to make sure that you feel a sense of gratitude giving back to our organization.
Sure.
And so over the last 5 years, since we unified our philanthropic efforts across the organization and began operating as a single foundation to support the entire system, we made the decision that we would transition to a much more committed way of going about our work, which is through the lens of relationships. Prior to 2020, we were a successful organization as you looked at fundraising work, but we were not doing relationship-based giving at the level that we should, or maybe even at the level that we had the opportunity to do. And so part of our significant growth has been because we began focusing on relationship-based giving. We all have those blessings that we experienced through COVID. There were a lot of things that we didn't like about the COVID experience, but there were things that ended up being some of those blessings. And one of those for us was that we weren't hosting events. People were not getting together. And so it allowed us to really accelerate our ability to build meaningful relationships with our constituents. And that's what's led to our growth of going from $17.7 million raised in a year was the most, to now 40, 50 plus million dollars on any given year. And it's been because of our focus on relationships, our deep commitment to our mission, and then our constituents' abiding belief in who we are as an organization and the incredible experiences that they have on any given day in our hospitals.
Sure, sure, sure.
And hospitals and long-term care and senior living communities are interesting places. Um, Over the last couple weeks, we've been touring other facilities as we prepare to build a new women's and children's tower on our tertiary hospital campus. And I leave those experiences the same that I leave our hospitals on any given day. And that's with the belief that hospitals and healthcare settings are some of the most incredible places in the world. They never close down, they're open 24/7. And the people who show up and live out their life's work in our hospitals and in our facilities are true heroes. Unfortunately, it took 2020 and the pandemic for us to recognize that, in many ways, or at least for the rest of the world to recognize that. But those are some of the most incredible people who show up every single day, on any given day, and they take care of whatever comes through those doors or in the air at that time.
Sure, 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 sure. Tell us a little bit about how you put forward your strategy around based upon relationships. How did you approach that? What were some of the kind of tactical steps you did to create the environment for these tremendous improvements?
Yeah, sure. Well, I can talk about our philanthropy plan, and I can talk about all of our work plans and the things that take place behind the
Sure.
scenes. But I think at the end of the day, it's the people who we have serving on our foundation team,
Right.
as well as our regional council members of the foundation, our individual governing boards for both the system as well as at a local level, that they all embraced our opportunity to become a world-class fundraising operation. And that's made the difference. We run our work similar to how you would run a capital campaign, and that's inside out, up and down. And so you get to know those closest to you. As a first step, you engage them regardless of what gift amount they can contribute, and then you work your way outwards to the rest of the community. That's made all the difference. And then when you layer that in with a mission and a culture like what we have at Avera, one that spans across 300 individual facilities, one that spans across 5 states, 72,000 square miles, you start to see some of those common threads that exist in all of our communities. And at the end of the day, Drew, philanthropy has always been part of this organization. Back in the day when the sisters began providing care more than 126 years ago, they relied on their community. They relied on their neighbors and their friends to be able to provide care. And our tertiary medical center, Avera McKinnon, was the result of a gift of $25,000 that was made in the early 1900s to create a hospital that would care for everybody, a hospital that would never turn away someone because of their inability to pay. And so in every way, philanthropy is part of the fabric of who we are as an organization.
Love that. Love that. Would you reflect a little bit about, as you look at a major gift opportunity, for our listeners, how do you prepare for that discussion? Starts obviously with the relationship, but any kind of thoughts on that, or the approach you take, or that you use with your team?
Yeah, our approach is really simple, and that's to get to know our constituents. Of course, we have plenty of data related to past giving, related to their other connections, maybe within our organization, or even their other philanthropic support in our communities. But we always start with let's engage and let's build a relationship with these individuals. And uh, gifts don't just happen overnight. They happen over a period of time. And so as we remain focused on engagement and deepening their connection with our organization, that's what allows those significant, beautiful, and heartfelt gifts to close in ways that sometimes we could have never dreamt up.
Sure.
I can share story after story, because so many of the stories of our constituents are emblazoned in my heart and in my mind. And so we have the privilege of sitting across the table with our grateful patients, with grateful families, with so many employees that give back to our organization. And we really have the chance to then learn about what inspires them to give back. Sometimes it is that above and beyond kindness that they maybe don't expect to experience in a hospital. Other times it's the fact that they've had their own life extended or saved, or that of a loved one. And so that makes a difference. And when you can lean into that, engage them in meaningful ways, that makes all the difference.
Indeed, indeed. Um, when you look at the various types of giving, major gifts, you've got mid-level giving, you've got planned giving, you've mentioned grateful patient. Is there one area in particular right now, or that you're focused on, and maybe some of your thoughts around that? How how you're looking to continue to change and grow and develop what you're doing?
Absolutely. So it's no secret that across the nonprofit sector, we're starting to see less and less individuals giving back to our organizations. We've been able to curve that at Avera. So we've seen year over year growth, not only in the total dollars raised, but in the total number of constituents. And so the group that we continue to focus on would be our mid-level donors, as well as the opportunity for us to be able to retain year over year constituents. We have hundreds, maybe even thousands of individuals who have given to our organization for 5 or more consecutive years. And so we want to make sure that we continue to retain them, because as a sector, we don't do that well.
Right.
Retention has not been something that nonprofits do, and that doesn't exclude hospitals. Oftentimes, the way that the nonprofit and the philanthropy or the fundraising sector goes related to trends in giving also happens in healthcare and in healthcare philanthropy. And so we know we're not immune to that taking place at our organizations. And so we do our best to continue to have strategies in place to retain our constituents year over year.
Is there anything specific you might share about specifically around retention? That's such a key driver for all of us across.
Yeah.
You're right. How do you think about that or approach that?
Absolutely. So we know how expensive it is to attract a one-time constituent or a first-time donor to your organization. We all are better off taking care of our existing constituents because it's far less expensive to retain them. But that takes work, that takes discernment, and that takes a strategy. And so through some unique stewardship, we've been able to increase our retention of first-time constituents as well as year-over-year donors.
Love that. How do you see stewardship? Again, that's a key component, key strategic component. How do you see that, or what are maybe some of the specific things you're doing, or where you're seeing good results?
Sure. So far more, Drew, than looking at dollar amounts that are attached to a gift, we are looking at behavior. So we're looking at individuals who are reoccurring supporters. We're looking at individuals who give every single year or who give throughout the year. We look at our employees even. I think for a long time, hospitals and health system philanthropy and foundation offices tended to look at their employees as a separate segment. We look at our employees the same way that we would look at our external constituents. Just because somebody works here does not mean that we should treat them any differently than we would treat another constituent if they're raising their hand, showing that they have affinity and a passion to support if their wealth indicators indicate that they should be engaged at whichever level,
Sure.
at mid-level, at major, at principal in some cases, or even at leadership levels for that matter. And so we've done our best to build true relationships with those individuals, despite that they may be badge in and badge out at our organization every single day. Just because you have an email address that ends with avera.org does not mean that we should not treat you the same way as we would with our external constituents.
Love that. Love that. Dzenan, you mentioned stories. Stories are always, or many times, powerful and inspiring. Are there any particular, maybe a recent story or one in the last several years or two that come to mind about a particularly powerful gift or initiative?
Yeah, I'll lift a couple. So we know how generous our employees are with their time, especially in the current workforce challenges that all employers, especially hospitals, face. We know that sometimes healthcare employees are doing a job and a half or maybe even two jobs, but yet every single day there's thousands of Avera colleagues who choose to give back through the foundation. And so some of those stories for me are the most beautiful. Recently, we had the opportunity to support an employee whose spouse was out of work because they received a solid organ transplant. And so the employee was out of work as well for a period of time as they cared for their spouse. And so they applied for Employee Assistance Fund support, which is our assistance fund that helps employees who are facing financial challenges.
Sure.
We provided that support to the employee, and they wrote the most heartfelt note, handwritten note back to me and to our foundation team. That's a note that I keep near my desk because it's a reminder to me why we do the work that we do.
Love that.
When I received that note, I, of course, went into that employee's record. Well, they've been employed at Avera for more than 3 decades, and every single year they chose to give back to the foundation and to the exact fund that ended up helping them decades later.
Oh my goodness. Love that.
And if there is anything more amazing, it's opportunities like that to be able to help someone who's been so generous, who gives of themselves every single day when they come to work, but who also was going above and beyond and providing generous support through the foundation for more than 30 years.
Love that.
And then I'll share another story. So we are in the process of building a new women's and children's tower on our tertiary hospital campus. There is a family who's had a long time relationship with our organization. Recently, when I visited them to talk about a very significant gift that they've discerned, that they've prayed about, that they've thought about significantly to support this campaign, there was a piece of paper sitting on the table when I walked in. And during our conversation, they slid that piece of paper in front of me, and it was the bill when one of the individuals with whom I was sitting with that day was born at our hospital. More than 80 years ago, when their life began, it was in our hospital, and the bill was for like $60-some. And they spent 10 days in our hospital, and so did their mom. And the only thing that I could think about was, had we known at that time, we would have written off that $67 bill, because look at the countless times that they've provided 6- and 7-figure gifts to our organization. And this is a family who's had decades-long relationship at our organization, not only from a philanthropic standpoint, but also from other standpoints of their own care, the care of their loved ones, the opportunity when they've welcomed new grandkids and children into their lives. All of that began in our hospital. And so for me, that was just such an amazing moment because few nonprofits have lifelong relationships with their constituents. In hospitals, we have the privilege of having that.
Mm, love that. Love that. What a great story. Thank you. Um, talk a little bit about, obviously, there are different constituents who get involved in fundraising. Certainly, your CEO and executive leadership. I've talked a little bit about your board or various boards, perhaps. Um, in your role, how do you collaborate, or how do you see those relationships? Um, what are some of the perhaps approaches you take that seem to work really well?
Sure. So we have plenty of data in healthcare to prove anything. Truly, if we need something, we can look back at the data in hospitals. And so we've taken that same approach in philanthropy of being really a data centered organization. And so as we looked at various ways of engaging constituents. This was during the pandemic, but also beyond now. We were able to look back and show that when we did partnership visits with subject matter experts, with nurses on units who are passionate about the work that they do, that gifts closed at a faster rate and that donors oftentimes provided gifts far above what our data could show us. And so we really have a commitment in our organization on partnership visits. And so on any given day, any member of our development team is likely engaging with nurses, with nurse managers, with vice presidents, with regional presidents, and CEOs to engage them in the work that takes place in the foundation.
Sure.
And by doing that, we've also educated more and more people about philanthropy. That philanthropy isn't Dzenan or a member of the foundation team showing up with a check and saying, hey, we got the gift. We can renovate the unit, or we can build a new wing, or we can buy this piece of equipment, or provide this level of patient and family assistance. They now know that there's a process to it. And at the end of the day, it's called development for a reason, because you're developing a relationship. And so as our constituents have had the opportunity to not only get to know the foundation staff, we've provided them the true privilege, and many call it a privilege, to meet the people who do the work every single day.
Love that. Love that. Just a couple more questions and we'll wrap it up. I am interested in your thoughts on sort of the future of healthcare philanthropy. What trends do you see? What, as you look into your crystal ball, how do you see this evolving? What are your thoughts there?
Yeah. Absolutely, Drew. Well, I opened up our conversation by sharing how complex healthcare is. Philanthropy tends to be complex as well, because we deal with people every single day, and we deal with people's lives in healthcare, but also in philanthropy. And I know over the last couple years, and this is true because of the Giving USA data, giving to healthcare has been increasing.
Sure.
I hope that continues to be the case. And then what I hope that follows is that health systems and hospitals continue to increase retention as well of our constituents. Because the more and more that our constituents can be engaged with the life of our individual missions, the more deeply connected they will be to giving back as well. And so we really have an opportunity to ensure that as we work on financing the business of healthcare, which is complex, as you deal with workforce challenges, as you deal with inflation implications, all of us are also dealing with long-range financial planning. Philanthropy can be one of those solutions to make that work. And at Avera, I've been able to have a front row and very close seat to seeing how philanthropy can be utilized to make a difference across the organization when it's utilized as a strategic partner and part of the highest level of conversations in our organization. So at Avera, Philanthropy sits around the executive table. So as we make decisions related to our growth strategies, as we make decisions around other issues and challenges that are coming towards, or opportunities that are coming to healthcare, I get to be part of those conversations, not only to provide the voice of the community, but also to be able to provide that philanthropic standpoint that, yes, indeed, philanthropy can be one of the key solutions to whatever opportunity or challenge we are facing.
Love that. Love that. Last question for those kind of younger fundraisers listening in, tuning in today. You've had tremendous success as a relatively young person. Do you have any advice or anything you might share about for young professionals who are interested in healthcare philanthropy, how to go about it?
Sure. So one of my greatest mentors on my first day of working in fundraising, uh, he and I met, and then we were going to go to lunch right after that. And I said, Jim, how can I be successful at this work? And Jim said, you need to be two things, be interesting and be interested. And that shouldn't be hard for you. So go do your job. So what I thought would be a 30-minute visit before we went to lunch ended up being a 2-minute conversation. And I've never lost sight of that feedback and that comment, because truly for us to do our work well, regardless of how old we are or what experiences we've had, we have to be interesting and we have to be interested. And so as I train and have the privilege of serving on boards or in other capacities in our sector, but also beyond, or when I mentor aspiring or young and newcomers to the profession, I always share that, because we have to be interesting and we have to be interested.
Love it.
And then we have to have passion for the work that we're doing. And so for me, I'm blessed that I've been able to do fundraising work for many years at only two places, each that mean the world to me. My alma mater, where in so many ways my life was changed because I received a scholarship and had experiences that that shaped me into the fundraising professional that I am. There are stories and experiences that I have as a student, but also as a development professional on that campus that made me who I am, that taught me that it does not matter where you came from, and it does not matter your age, that if you work hard and you're willing to roll up your sleeves and do the work of the world, that you can be successful. And then at Avera, where I had not done healthcare philanthropy up until I started serving at Avera. And it took not very long for me to fall in love with this mission, because nothing matters more than healthcare. Nothing matters more to people than when they get to have incredible experiences in any of our hospitals. And I'll say that for all healthcare settings, that truly our work is a privilege, because we do work that truly changes lives every single day. And there's nothing more humbling than that. And I know that many of us work long hours, and there's always somebody to call and someone to reach out to. But if you stay the course, if you have passion, if you're interested and interesting, you're going to be successful in this work.
Love it. Love it. Thank you. Thank you. Thank you for your time today, for all your wisdom. And thanks again.
Thank you, Drew.